So I'm here to say that I have read almost every federal health and human service law there is in the last year. I didn't read any law or regulation that said information cannot be shared.
There is a lot of pressure with HIPAA and this whole electronic health record to have tighter security. And there are actually penalties happening around breaches and how we respond to breaches. And there is push to integrate and to interoperate. And there is not a consistent federal policy framework that says you can do this and you can do this and here's why you cannot do that.
There, talking to a judge, I realized they were building an information system for the courts at the same time that we were updating our child welfare information system. And we had done an excellent job of maintaining absolutely no contact with each other and building them in complete silos to guarantee that in no way could we share information or work effectively with each other.
Information is a strategic asset. It's an extraordinarily valuable asset. It's no longer, as you've heard, whether we should, but now the question is, how do we share data? For the efficient and effective delivery of health and human services, it's a social and economic imperative. It makes possible the highest state of community social health for the greatest number of people.
With any kind of program, you need those red-haired champions that have the commitment to say we can and we will find a way to make this sharing for the child possible between all the agencies.
Our SACWA system is it's state of the art for 1989. We're still working with a mainframe. You got to be sitting at your terminal, at your desk, connected by a line to that server over there in order to enter data, get data, do what you need to do.
Technology is really less of a barrier these days for health information exchange to happen. It's really the barriers are policies. There's that little money piece too, but policies is really the primary barrier. So one of the things I wanted to focus when I talk about innovative IT projects is a little bit of both, not just the innovative ones on the technology side, but the innovative ones on the policy side, and that's what this panel is really going to talk about. Keep it in perspective, especially when we're thinking about interoperability and health information exchange. What's the win? What's the sell? Why should we invest in this? And it's because the best way to lower our healthcare costs are to get connected to the things that are outside of our healthcare delivery. Personal opinion.
So health IT is what you can do with IT. Informatics is what you should do with IT. And when you start thinking about the should, you start thinking, well, we know all the cans, and we know we shouldn't be negative, we know we should be positive and all that sort of stuff. But sometimes we have to view these things as interventions that have benefits, but they also have costs.
I really commend Stewards of Change for this work and the fact that you all come together to work on this, and hopefully at some point we'll recognize that we're in 2012 and that it's time that we started doing this, utilizing the technology that's available to help us do our jobs in the best way possible.